So I hear from, I hear from families all the time that they're just overwhelmed by this process of trying to access long-term care, and they feel like they must be doing something wrong. But I just want to say up front that these programs, you're not doing something wrong, because the programs are hard to navigate and it's hard to find the care. Our country and our state does not make it easy. So if you feel lost and frustrated, just know that you're in good company. So let's get started with just real briefly. If you don't know, or if you're unfamiliar with the work of TJC, we are a nonprofit public interest firm, law firm that uses individual cases to identify systemic risks to the state's safety net programs, and then advocate for change through legislative action, class action, and client representation at administrative hearings. We also seek to improve our state safety net programs by connecting our clients with media opportunities to share their story and to shed light on the ways that our current systems need to be improved. We also leverage our knowledge of policy by hosting webinars like the one today to increase public awareness of the programs, of these public safety net programs, and to provide insight into best practices and common pitfalls that we see act as a barrier to care. So for today's agenda, first we're going to cover what long-term care is, just to make sure that we're all on the same page about the different kinds of care that we're talking about when we say long-term care. I think one of the biggest gaps or one of the biggest barriers in navigating these care systems is like a jargon or language barrier. A lot of times these kinds of services are wrapped up in coded words and all kinds of jargon. So we want to talk more about what long-term care is. And some people think of just nursing homes when you say long-term care, but there's a lot more to it than that. And then we'll do an overview of the role that Medicare and Medicaid play when accessing long-term care. Again, just to make sure that we're all on the same page, Medicare is the federal health insurance program for people who are 65 years or older. Medicare is also available to some younger people with disabilities and people with end-stage renal disease. Medicaid, however, is a joint federal and state program that provides health coverage to nearly 72 million Americans, and each state runs their Medicaid agency differently and has different eligibility rules and coverage categories. There are some groups of individuals that states are required by law to cover through their public Medicaid program, but you'll find vast differences between each state's Medicaid program. And the Medicaid program in Tennessee is called TennCare. So you may hear people use Medicaid and TennCare interchangeably. Just know that TennCare is Tennessee's version of Medicaid. And then we'll cover a few other long-term care options for families who live in Tennessee. And hopefully we'll have some time at the end for some questions. Please feel free to put your questions in the Q&A box right when you think of them. You don't have to wait to the end, because I know that you might forget your question at the end. And if I answer your question sort of later on in the presentation, we have TJC staff on the call who's going to help me with that piece of it. So if we're able to have any time at the end to answer questions, that's where we'll go to, is the Q&A box. And then just one more caveat before we get started. While I'm familiar with the services available, with most of the services available through Medicare, I am by no means a Medicare expert and may not be able to answer all of your Medicare questions today. If I don't know the answer to your question, I'll follow up after the training. I promise that I won't make up any answers today. My experience and expertise is primarily in Medicaid, more specifically with Tennessee's long-term care Medicaid program. And while TennCare is typically seen as a public benefit program for low-income families, we have seen more and more middle-class families turning to Medicaid to pay for their loved ones' long-term care because it's just too expensive to pay privately. In fact, over 60% of all nursing home residents in Tennessee are enrolled in TennCare's long-term care program. So with all that being said, let's get started. The National Institute on Aging is one of the 27 national institutes of health under the U.S. Department of Health and Human Services, and they define long-term care as care involving a variety of services designed to meet a person's health or personal care needs during a short or long period of time. These services help people live as independently and as safely as possible when they can no longer perform everyday activities on their own. I wanted to show a short 4-minute video by the National Institute on Aging that describes the different kinds of long-term care. Let's get that going.
When people hear the words long-term care, they often think only of nursing homes. But long-term care includes much more.
Long-term care is a wide variety of services and supports to help meet one's personal and health care needs over an extended period of time.
The most common type of long-term care is actually personal care, services that a person receives in the home from paid or unpaid caregivers. Home-based care includes home health care, personal care, homemaker services, friendly visitor companion services, and emergency response systems.
Home-based long-term care is primarily care received in your home. It is generally care, as I just mentioned, to complete your activities of daily living. And again, that's bathing, dressing, and it also includes other activities that support you in your home. Shopping, meal preparation, getting to doctor's appointments. All of these things are home-based services.
Long-term care also includes services that are available outside the home, called community-based services. Community-based care includes adult daycare programs, senior centers, transportation services, meals programs, and respite care. Community-based care supplements services available in the home, making it easier for a person to live at home.
Community-based services are basically services that are available in the community. Generally, they supplement the services that people get and need in their homes, and they help people to stay in their homes. Community-based services include things like adult daycare services, which are service programs that provide supervision and nutrition programs.
And look up at your elbow if you can. And then slowly press down with your big toes. Lift your knee.
Other community-based services include meal programs, transportation services to help people get around, and senior centers.
Senior centers are very important in the community. They are generally for kind of well elderly or elderly that don't need supervision, but they do provide social, recreational, and nutrition programs for people in the community.
When people are no longer able to live on their own and need full-time help, they may require long-term care in a facility, such as a nursing home. Facility-based care includes adult foster care, board and care homes, assisted living facilities, nursing homes, and continuing care retirement. Facility-based care is for those who require help and can no longer live on their own.
Nursing homes provide 24-hour housing, healthcare and personal services, supervision 24 hours a day, and most nursing homes also provide rehab services.
To find out about long-term care services that are provided in the home, in the community, or at a facility, contact the Elder Care Locator at 1-800-677-1116 or visit www.eldercare.gov. You can also contact your local area agency on aging.
So that just gives a little overview of the different kinds of long-term care that we are, when you say long-term care, it's an umbrella term, obviously. And the cost of paying for long-term health needs can be enough to break anyone's budget. In fact, the median cost of staying in a semi-private room at a skilled nursing facility in Tennessee is $84,863 a year, according to insurance provider Genworth Financial. And having a home health aide assist in the home with activities of daily living, such as bathing, dressing, or eating, for 40 hours a week has a median price tag of $43,680 per year in the state of Tennessee. So these high price tags in combination with our increasing life expectancy means that many Americans are just outliving their savings and are having to turn to these social safety net programs to cover their long-term care needs. So the sort of long-term care benefits that are available under Medicare. Just off the top, Medicare says that it does not cover long-term care or anything that it deems as custodial care. And custodial care is non-skilled personal care, things like bathing, dressing, eating, getting in and out of a bed or chair, moving around, or using a bathroom. In the eyes of Medicare, custodial care also includes the kind of health-related care that most people can do by themselves, like using eye drops. So in most cases, Medicare does not cover custodial care. It does cover short-term nursing facility stays in a semi-private room. Medicare will pay for eligible individuals in care in a skilled nursing facility for up to 100 days. Under the program, the first 20 days are covered at 100%. And then for the remaining days, the patient must make a daily coinsurance payment. If the patient, and the numbers on the slide are based on 2021. If the patient remains in the nursing home longer than 100 days, Medicare will make no further payments during that sort of spell of illness. And a spell of illness refers to the condition for which the patient was initially hospitalized. So in order for Medicare to cover any nursing home care, you have to have a qualifying hospital stay before you go into the nursing home, and we'll talk more about that in the next slide. But so if after the 100-day coverage limit, a patient is discharged to go home and then remains well enough to not need any sort of skilled care for at least 60 days, and then the patient's condition declines to the point that they need hospitalization and rehab care again, that is considered another spell of illness. So this situation makes the patient eligible for another 20 days of full coverage and then 80 days of that partial coverage. And there's no limits to the number of benefit periods you can get as long as there's that 60 days in between each spell of illness. And then Medicare will also cover some home health services. You don't have to go to a hospital before it'll pay for home health services, but that's often when we see people getting home health services through Medicare. But the kinds of home health services that are available through Medicare include part-time or intermittent skilled nursing care, physical, occupational, and speech therapies, and then part-time or intermittent home health aid services. If Medicare will cover those home health aid services as long as you also need some other kinds of skilled care. So you may already know that Medicare Part A covers care in a hospital, Medicare Part B covers care at the doctor's office, and then you may also have Medicare Part C, also known as a Medicare Advantage. Medicare Advantage plans can save out-of-pocket costs traditionally associated with original Medicare. And most of these plans, they can offer extra benefits and lower co-payments than original Medicare. However, participants may have to see doctors that belong to that specific plan or certain in-network hospitals to get services. And Medicare supplement plans also may help with those co-payments and co-insurances. Medicare doesn't pay for 24-hour a day care in the home. It doesn't cover home delivered meals in your home, and it won't cover homemaker services like shopping, cleaning, and laundry when this is the only care you need. Custodial and personal care like bathing and dressing or using the bathroom is also not covered when it is the only care that you need. If you need it in addition to like physical therapy or speech therapy, some sort of skilled care. I hate that they sort of define it as skilled or unskilled, but because I think that it takes a lot of skill to provide personal care services, but that's sort of the language that's used with Medicare. So they only will cover this sort of custodial care if you also need a kind of skilled service as well. All right. So to be eligible for a short-term stay at a nursing facility that Medicare will cover, Medicare Part A will cover skilled nursing care for a limited, for those 100 days, if all of these conditions are met. You have Part A, you're enrolled in Medicare Part A, and you have days left in your benefit period to use. So this first bullet point is about that 100-day limit we discussed in the last slide. So you have to have some days left in or be in a new benefit period because you've been out of the nursing home for at least 60 days in order to get nursing facility care. Apologize for that. And then you have to have a qualifying hospital stay before Medicare will cover your short-term nursing facility stay. So you have to have at least 3 inpatient days at the hospital in order for Medicare to start or for Medicare to cover your short-term nursing facility stay. The time you spend at a hospital as an outpatient before you're admitted does not count towards the 3 inpatient days. So you need to make sure that the hospital, or at least keep track of when the hospital is formally admitting you versus whether you're just there for observation, because observation also doesn't count. But you have to be actually admitted for 3 days before Medicare will cover a nursing home stay. And then your doctor also has to say that you need daily skilled care in order for Medicare to cover the short-term nursing facility stay. And you have to need skilled services for a medical condition that either is a hospital-related medical condition that was treated during your qualifying 3-day inpatient hospital stay, even if that wasn't the reason that you were admitted to the hospital, as long as you were treated for at least 3 days in the hospital, then that counts. Or a condition started while you were getting care in a skilled nursing facility for a hospital-related medical condition. For example, if you develop an infection that requires IV antibiotics while you're in the skilled nursing facility. All right, and then eligibility for home care to be covered by Medicare. So your Medicare Part A and Part B covers home care if all of these conditions are met. So you must be under the care of a doctor, and you must be getting services under a plan of care that's created and reviewed regularly by a doctor. Basically just a doctor has to order these services. And the doctor must certify that you need some kind of skilled care, like nursing care, physical therapy, speech language pathology, or occupational therapy. Those are sort of the skilled services that a doctor has to certify that you need one of those. And then the services must be specific, safe, and effective treatment for your condition. And your condition must be expected to improve in a reasonable and general predictable time period, or you need a skilled therapist to safely and effectively make a maintenance program for your condition to help you learn how to maintain your current level of health and safety, or that you need a skilled therapist to safely and effectively do maintenance for your condition. So that means you require a therapist or some sort of skilled provider to come into the home for you to maintain your current level of health and safety, and that without the care that your condition would get worse. And then of course also the home health agency caring for you, it must be certified by Medicare, and you must be considered homebound. That's an important piece. You must be considered homebound before Medicare will cover any home health services. So Medicare considers that you are homebound if you need the help of another person or medical equipment such as crutches, a walker, or wheelchair to leave your home, or if your doctor believes that your health or illness would get worse if you had to leave your home. And it is difficult for you to leave your home, and you typically don't do so. If you leave your home for religious ceremonies like once a week, or to leave to go to doctor's appointments, that kind of thing, that's still okay. You can still be considered homebound even if you leave for those types of visits. But just be aware that that is something that Medicare requires before they'll cover any home health services. So some common concerns that we see with Medicare and long-term care, again, just off the top, is that it doesn't cover long-term care, right? It's really only seen as short-term care at the skilled nursing facilities, and services can technically go for a longer period of time receiving if you're receiving care in the home or community. But a doctor must continue to order the care and say that it's medically necessary. And getting this sort of ongoing home care can be difficult to keep, because we see that Medicare will frequently check in to see if the services are still needed, if you still qualify for those services in the home. So they'll be checking in with the home care provider and your doctor saying, well, are they expected to get any better? Are they improving? Or is this important for maintaining their current level of care? And if not, or if there's a question about it, we see that Medicare insurance plans will try to cut those services. People usually come home with just a few weeks of these skilled kind of services in the home before Medicare stops paying for that care. Another issue that we see frequently is that it only covers personal and homemaker care if you also have skilled needs. So some people who are just needing support with taking a bath, for example, that's not reason enough to qualify for Medicare home health unless you also are going to get some sort of occupational therapy in addition to help with bathing. But then again, it can still just be for a short time. So, and if you have any additional questions or concerns, you might want to look into contacting the Tennessee SHIP program. SHIP stands for State Health Insurance Assistance Program, and it's for Medicare participants and provides free and objective counseling about Medicare insurance to all Medicare recipients and their caregivers. They can also help sort of give unbiased advice about what sort of supplement or advantage plans may work better for you or be more helpful in accessing care or making your Medicare services more affordable. You want to be careful when talking to any sort of insurance broker or somebody who might be biased in trying to sell you a product. And you can be sure that SHIP is an office and a resource that provides unbiased guidance about which Medicare plans will work best for which people. Okay, now moving on to Medicaid. When you are talking about TennCare or Medicaid and talking about long-term care, you're talking about the Choices program. So Choices is long-term care insurance through TennCare or Medicaid, and it provides long-term care for adults age 21 years or older with a physical disability or seniors age 65 years or older. Choices can get a person care in a nursing home, as well as certain services to help the person remain at home, safe at home in the community. You'll often hear these being called home and community-based services, or HCBS. It's just another one of those acronyms. That's tied up in the long-term care sort of sphere is HCBS. So in choices, there are 3 different groups or 3 different categories of choices. Choices group 1 covers care in a long-term care facility or in a nursing home. Choices group 2 covers care in the home. The amount and specific type of services that you get in the home are determined by a care coordinator. So anyone who is enrolled in the choices program is also enrolled in full Medicaid or TennCare benefits. And in the state of Tennessee, our Medicaid program is most of the benefits in our Medicaid programs are serviced through managed care organizations or MCOs. So in the state of Tennessee, we have AmeriGroup, Blue Cross Blue Shield, and United Healthcare that provide that contract with the state to provide these Medicaid services. So as soon as you're enrolled in Choices Group 2, or any of the choices actually, but in Choices Group 2, you'll get assigned an MCO, and then you'll also get assigned a Choices Care Coordinator. And that care coordinator will facilitate the setting up of the services, the amount of hours of care that you get in the home. And that care coordinator will also make any changes to the plan of care as the client's needs change. Through my years of being involved in the Choices program, I find that sort of how helpful or not helpful the Choices program is to the enrollees really depends on how good of a care coordinator they get. So that role is really important. And you want to make sure that you sort of, when you get enrolled in Choices, that you have a good contact number for your Choices care coordinator. And then Choices Group 3 covers care in the home, but it's limited. So usually these individuals are less needy, they have less intensive needs, and need less intensive services or less hours of care. And the annual cost cap of services available in Choices Group 3 is $15,000. So we know that, for 40 hours a week, the average cost, I said earlier, was like 43 something. So you can see that an annual cost cap of $15,000 really only gets you very limited care in the home. And I believe it was like in 2015, the state changed the rules for Choices Group 3 so that it is only open to people who draw SSI or supplemental security income. So Choices Group 3 is only open to those people who draw SSI. I also forgot to mention that in Choices Group 2, that is where assisted living facility care is also covered. TennCare doesn't cover room and board at an assisted living facility, but there are limits to how much an assisted living facility can charge for the care that a person receives at an assisted living facility. But just know that if you're thinking that maybe your loved one would need to be in an assisted living facility, that is also covered under Choices Group 2. And then any care received through in a home and community-based setting must be cost effective, meaning that the services provided in home and community-based setting must not exceed the cost of care that would be available in a nursing facility. So the state doesn't want to pay you more money to get care in the home and community. So just to keep that in mind, that the home and community-based care must be cost effective. So to qualify for Choices, you have to meet both medical and financial eligibility standards. I encourage people, I think it's easier to think of these as almost 2 separate application processes. One is for financial eligibility and one is for medical eligibility. You have to be both medically needy and financially needy to enroll in Choices. And we are going to start with the financial eligibility for Choices first. So there is no income limit for Choices, but income over the $2,382 a month must be put into a special income trust arrangement This limit, this 2,382, that is for the 2021 year, and it changes, well, it usually changes every year, goes up by just a little bit. But so if you'll hear people talk and say that the choices income limit is $2,382. But we encourage people to think of it as no limit, because any income that's over that amount can be handled in this special trust, and then a person becomes eligible. In most Medicaid categories and other sort of Medicaid programs for children or for families, if you're over sort of the income thresholds, you're sort of out of luck. There's nothing that, you're just not eligible. But for the Choices program, they have there's a special trust that you can put your money into that would make you eligible. So we encourage people to think of it as no income limit, but just knowing that if your income is above $2,382 a month, that you'll have to, do some sort of rearranging with your money. And only the applicant's income counts towards the limit. So if an applicant is married or lives in a household with multiple people in it, still only the applicant's income counts. The applicant's share of resources must be below $2,000. Married individuals are allowed to keep more assets. So I just want to mention that one homestead and one car is excluded from that asset limit. And married individuals, there's the applicant who's applying for choices, and then the applicant who's not applying is called the community spouse. And the community spouse is allowed to keep at least 1/2 of all of their shared assets. So while income is looked at individually, assets are looked at, married individuals, the state looks at their assets together and splits them in half and assigns half of the value to the community spouse and half the amount to the applicant. However, there is a rule that says that the community spouse, while the community spouse is allowed to keep 1/2 of the assets, they can't get less than $26,067. So that means that if they're sort of allowed to keep a larger chunk of the assets, if the combined assets are less than $26,000, then sort of all of them get deemed to the community spouse, and the applicant doesn't have to worry about being over that $2,000 limit. That's kind of confusing, and if you have any issues with it, please feel free to contact our office. We've been hearing from a lot of clients who are married and they apply for choices and TennCare denies them, saying that they're over assets, but it's just because TennCare didn't appropriately assign all the assets that should have been assigned to the community spouse. And so they sort of denied them improperly and illegally. And so that's just a common issue that we're seeing, and that you may want to be on the lookout for if you apply for choices and get denied because you're over assets. It could be because TennCare isn't properly assigning enough assets to that community spouse. And then again, like I said before, choices group 3, to qualify financially, the applicant has to draw SSI. So medical eligibility for the Choices program is based on whether the applicant scores high enough on an acuity scale that measures specific activities of daily living. So the pre-admission evaluation, or PAE, is the name of the assessment that the state uses to determine whether an individual is medically needy enough to qualify for choices. The PAE looks at 11 different activities of daily living and assesses whether a person needs assistance from another human being to complete that activity. A score is assigned depending on what activity the individual needs help with, and depending on how many times per week the applicant needs assistance to complete that activity. So for choices groups 1 and 2, applicants must need what they call nursing home level of care. And so even if they're seeking care in Choices Group 2, which remember is care in the home and community, they still have to meet that nursing home level of care standard. A lot of people are sort of uncomfortable with that, and especially applicants who are afraid they'll be forced into an institution, you know, are worried about that nursing home level of care. But just rest assured that that you can, in order to qualify for Choices Group 2, which is care in the home, you still have to need that nursing home level of care. And that's measured as a 9 or higher. You have to score a 9 or higher on the PAE. And then Group 3 just requires that you have a substantial deficit in at least one activity of daily living. Individuals seeking Choices Group 1 or 2, but score lower than that 9 on the PAE may request something called a safety determination. And a safety determination form sort of supplements the PAE and gives the state a fuller picture of how not receiving the services would cause the applicant to be unsafe or at risk of harm. So if an applicant is approved for Choices Group 3, based on their medical eligibility, and they were actually seeking a Choices Group 1 or 2 placement, a safety determination form can be used to show how the applicant's needs exceed the services that would be available in Choices Group 3. So you have to sort of prove that your needs exceed the services that would be available under that $15,000 cost cap. Okay, so this is the Pae Acuity Scale. This is how the state sort of determines which points you get and how many points you get. You can see that each functional measure that's assessed has the possibility of 4 different answers. And so always means that the applicant is always able to do that activity independently. So transferring, for example. Transferring functional measure is assessing an applicant's ability to transfer from the bed, chair, or toilet. And so if the applicant is always capable of transferring from the bed, chair, or toilet independently, then they would get a score of 0, right? Because they are always independent with that functional measure. Usually it means that the person is usually independent with completing the functional measure, requiring assistance only 1 to 3 days a week. Usually not means the applicant is usually not independent with that functional measure and needs assistance 4 to 6 days a week. And never means that the applicant needs assistance with completing that functional measure 7 days a week. It's important to note that if you're trying to score any points on the PAE, like needing help from a tool. So like if you have to use a walker to get out of a chair, or if you have to use a lift chair to transfer, you're still, the state considers that you're still completing that activity independently, and you won't get any points for that. You have to need help from another human in order to get points from that. You can see that it's not as easy as people might think to qualify medically for Choices. I hear from a lot of people who say they need assistance with bathing, or they need assistance with cooking, or they need assistance with dressing. And you can see that dressing and cooking and bathing are not assessed as part of the PAE, unfortunately. You know, there are things like eating is assessed. You can see that in the blue line, but it's really only assessing whether a person is able to get food into their mouth. So it's more difficult than people might think to get a 9 or higher. And remember, you have to get that 9 or higher on the PAE in order to qualify. Also, a lot of the functional measures are assessed together. So that also makes it harder to get as many points as you need to qualify. So for example, you can see the transfer and mobility functional measure. Transferring, again, is assessing whether you're, transferring from the bed, chair, or toilet, getting up and down from the bed, chair, or toilet. And mobility is assessing your ability to get around the home. And only the highest of those 2 measures will count towards the final score. So if you're never able to transfer independently and you're never mobile independently, you still only will get a 4 because those 2 measures are scored together. And then I just want to bring attention to the fact that the behavioral functional measure down here at the bottom, that's assessing like a person's behavior. So if they are if they're lost or wandering or disrobing or trying to eat unedible things or being violent, or they're sort of putting themselves or others at risk of harm, then they might be able to get some points for the behavioral functional measure. But you can see that it's sort of scored opposite of the rest of them. So a response of always in the behavioral functional measure means that you always need help with behavior. I don't know why they sort of changed up the scoring for that last one, I guess just to add a little bit more confusion and excitement. In this whole PAE process is the state's attempt to make a black or white sort of eligibility requirement. Either you're eligible or you're not. But the truth is that there is still a lot of gray, and it really depends on how the questions that the assessor asks and how open and honest the applicant is. And so you just want to make sure that there is an advocate present when your loved one is applying for choices, to make sure that all of their needs are being communicated effectively. We always try to put our best foot forward when we're meeting a stranger, and it's sometimes embarrassing to talk about needing help with toileting, for example. But being open and honest like that can really make the difference between getting care or not getting care. So to apply for choices, if you're not already on TennCare, you would contact your local area agency on aging and disability. There are 7 AAADs across the state. You can Google your county and then AAAD, and the correct office should show up. Many AADs are housed within other organizations. So for example, the Southwest Tennessee AAAD is housed in the Greater Nashville Regional Council, or GNRC, you may have heard that. And the East Tennessee AAAD is part of the East Tennessee Human Resource Agency, or ETHRA. So you may have heard those. I think all of that is sort of just adds to the complication of applying for long-term care benefits, because different agencies handle different parts of it. And so just keep that in mind. And then if you're already on TennCare, you would just apply through your managed care organization like we talked about before. So that's AmeriGroup, United Healthcare, or Blue Cross Blue Shield. Some hospitals have people on staff that will help people apply for choices. And most nursing homes already have people on staff who know how to help people apply for the choices program. And note that the state has 90 days. Usually for Medicaid applications, they have 45 days to process applications, but because Choices has this both financial and medical eligibility piece of it, the state has 90 days to process Choices applications. So you wanna make sure that you apply early. And I found that sometimes the AADs in nursing homes and hospitals are helpful with the financial part of the Choices applications, and sometimes they aren't. Sometimes they just tell families to apply for TennCare on their own by making a TennCare Connect account online. But then the nursing home or the AAAD or the hospital staff will just do the PAE. So while you can complete or start the financial application online on your own, you'll still have to go through either the AAAD or the MCO or a hospital or nursing facility staff, because the PAE has to be submitted by a certified assessor. All right, common concerns that we hear about Medicaid and long-term care. So we get a lot of calls from people who say that they've contacted their MCO or their AAAD to start the Choices application. And usually when you do that, there's a sort of informal over the phone screening that somebody on staff will do with you to see if they think you would qualify for Choices. And at that point, applicants our clients are given sort of wrong information. Like we hear all the time about people saying, well, they told me because I drive, I can't qualify for Choices. And while there's a little bit of truth to that, like somebody who drives may not be able to score a 9 on the PAE, but it doesn't, there's no law or something that that says if you drive, you can't qualify for choices. I mean, I've heard of people who, you know, don't want to give up their car because, you know, being able to drive gives them all sorts of a sense of freedom and that kind of thing. And so they'll literally like crawl out from their home to their car in order to still get in their car. And so that person may be able to get a 9 on the PAE and they still drive. So it's not sort of that there's no rule that says if you drive, you can't get choices. But we hear things like that all the time as clients call us saying that they were turned down after this sort of informal over the phone screening. You should know that even if you're told over the phone that it doesn't look like you're eligible, that you still have the right to apply. I advise people to say that they would still like an official PAE and safety determination request form submitted to the state on their behalf. Another thing that I wanted to mention is the QITs, or qualifying income trust. So that's the name of the special bank account that I was talking about before when we were talking about financial eligibility. So if you're over that $2,382 income limit, you have to set up a QIT. And a QIT is just a special bank account with one purpose: to make someone choices eligible. Money in the QIT can be spent on medical needs like premiums, medications, patient liability, or personal needs allowance. Some banks require that a lawyer draft the QIT and some banks don't. So I would just recommend calling the bank and seeing if your bank, you know, knows what a QIT is. Most large banks know what a QIT is already. And some legal aid offices can also help set up QITs once it's the last piece of getting choices approved. If you have any questions about QITs, feel free to reach out to TJC and we can point you in the right direction. Another big thing that we hear from choices applicants or Medicaid long-term care applicants is concerns about estate recovery. So estate recovery is, there's a federal law that requires TennCare to try and get back the money they spent on paying for people who were over the age of 55 and were on choices. For some people, this means that TennCare tries to force the sale of their home and take some or all of the money from the sale once the choices enrollee passes away. Estate recovery is complicated and has many exceptions. Confusion about estate recovery should never prevent someone from considering choices. We hear all the time that people are scared away from applying for choices because of estate recovery, or they're told that TennCare will put a lien on their house, and it's not a lien. And sometimes, you know, the clients who are worried about it actually are still paying a mortgage and don't have much equity at all in their home. And so it doesn't really make sense for them to be worried about estate recovery. Anyways, all this to say that just if you're concerned about estate recovery, call our office and we can talk you through some more exemptions and exceptions to the rule. And that's still, it shouldn't be something that scares you away from even considering choices. And then there's also a 5-year look back period, which can be a problem for some people who are applying for choices. When a person applies for choices, the state completes a 5-year look back period to see if that person has sold or gifted property or any assets for less than fair market value within the past 5 years. This is to keep individuals from giving away their assets to their children for the sole purpose of becoming Medicaid eligible. If the state sees that a resource was given away within the past 5 years, they may be assigned a penalty period where the applicant cannot enroll into the choices program for a period of time. And the length of the penalty period is based on the value of the asset that was given away. So the more expensive the asset was that was given away, the longer the penalty period will be. There are also ways around a penalty period. If the state finds that you have to pay a penalty period, you can contact TJC to see if you could qualify for an exemption or a hardship waiver. There's also hardship waivers to sort of get around the penalty period. And then also just generally in Medicare and Medicaid, I wanted to highlight the caregiver crisis. There is a national caregiver shortage in this country. We a lot of people who are enrolled into these programs are then, disappointed by the lack of consistency of caregivers or, frequent missed shifts. It just sort of depends person to person, area to area, how good the staffing networks are there and the service provider networks. But it's a really big problem. It stems partly, I think, from sort of undervaluing the caregiving profession. We don't value the work and the labor that goes into providing care to individuals, and even our family caregivers, are just being sort of run into the ground because we don't value caregiving as an important part of our society structure. But it really is valuable, and so often these caregivers and home health aides are paid really less than they should be paid. And so it causes all these holes in the provider networks, making it sometimes difficult to access care, even when you're approved for these programs. All right, and then briefly, just other programs that are available to Tennesseans that could help with long-term care needs. There's the Options Program for Community Living, is a state-funded program. The program was created to provide the elderly as well as adults with disabilities home and community-based service choices. This program is available through local area agencies on aging and disability. So those AAADs, the same people that help with choices application, or the same office that helps with choices applications, also sort of manages the Options Program. You must be a Tennessee resident, be 18 years or older, and must need help with at least one activity of daily living. You can get homemaker services, personal care services, and home delivered meals. It's usually in the Options Program, the amount of care you can get is pretty limited to like 1 or 2, maybe 3 times a week, just for a few hours. When I worked as an options counselor, it was mostly helpful for people who needed, help with doing their laundry a couple days a week, things like that are hard for some elderly people to do. And so that was how that benefit was used. And there's no income eligibility for the Options Program. However, there is a sliding fee scale based on income. Then the National Family Caregiver Support Program. It's also run through the AAAD, and it provides assistance to adults age 60 years or older, adults with Alzheimer's disease or related disorder, and grandparents or relative caregivers who are 55 years or older and caring for a minor child. The services that you can get through this program include counseling and support groups, caregiver training, respite care, personal care, and homemaker services and adult daycare. For both of these programs, just fair warning, there's some in many counties in Tennessee, there's like a 2-year waiting list. So if your name gets put onto one of these waiting lists, be sure to call the AAAD anytime you have an update on your health, if you go into the hospital, or if you have a healthcare emergency or something changes in your health, because that might bump you up in the priority to getting the Options Program quicker, or get through that waiting list sooner if you have those kinds of health, declines. And then the VA does cover some long-term care benefits. Services in the home and community are available if you can demonstrate clinical need for them, and if there are service providers in your area. So that's a big caveat for VA benefits, is that there has to be a provider in your area. They also may cover care in a residential setting, like a nursing home, if there is a VA skilled facility in your area. If you meet certain eligibility criteria involving your service-connected status, level of disability, and income. I also wanted to mention a specific VA benefit that is frequently underused called Aid in Attendance. And this is a program that increases qualified veterans and/or survivors' monthly VA pensions to help with paying for services you need to stay safe in the home. So paying for, a caregiver to come a couple times a week into the home. Aid in Attendance can help with those costs. So if you receive a VA pension, you may be eligible to receive this additional monthly monetary benefit from the VA if you require help from another person for everyday personal care needs, such as bathing, dressing, or toileting, if you're bedridden, or if you live in a nursing home and are physically or mentally incapacitated, or you have poor eyesight. You can contact the Veterans Benefits Administration office for more information and to see if you could qualify for aid and attendance. But if you're already getting a VA pension, I would encourage you to look into that benefit to see if that can help with paying for some care in the home. And then really briefly, private long-term care insurance is hard to get. If you have a high risk of needing long-term care services, you are less likely to qualify. So according to the American Association for Long-Term Care Insurance, 32.5% of individuals ages 65 to 69 were denied long-term care insurance. This was based on 2019 numbers, but it jumps up to 51.5% of individuals aged 75 years or older were denied long-term care insurance. So I know my parents tried to apply for long-term care insurance and were denied based on my mom's medical history. So for many people, it doesn't make sense to buy long-term care insurance. Long-term insurance companies have a history of hiking up monthly premiums each year, sometimes getting close to doubling those monthly premiums. And if you can't afford to pay those monthly premiums and save for retirement at the same time, it might not make much sense to pay for private long-term care insurance, especially because not everyone needs long-term care. But it does make sense for some people. So, you want to make sure that you talk to an unbiased financial advisor who may be able to help figure out if private insurance, long-term care insurance is right for you or something that could be helpful for you. All right, I know that was a lot of information I just sort of blew through. I've been sort of going quickly and not tracking to see how many questions we have. Are there any questions that we might be able to answer in the last few minutes that we're here? I see that it's almost 12 and the presentation was supposed to end at 12. So if you need to go now, that's fine, but we can stick around for another 10 or 15 minutes to answer some questions if you all want to stay around. But that's the conclusion of my presentation. You can contact trainings at tnjustice.org for if you have any questions about this presentation or future presentations. And again, just a reminder of those upcoming training opportunities that are available. So thank you all. And if you have to go, then thank you for tuning in. And Nicole, if there are any questions that you want to ask or that have come in that you think we can ask the group.
Yeah, so the first question, I think you kind of just answered that, was do you advise purchasing a long-term care policy?
Do I recommend it? Mm-hmm. Yeah, so I think, like I said, we talked about that in the last slide a little bit. It doesn't make sense for a lot of people, but it could make sense for some people. It's really just dependent on people's individual circumstance and the plans that they're able to find. And so, and I don't have much expertise, like I said, in private long-term care plans. And so I would advise that you talk to an unbiased financial planner, someone who can sort of give better advice based on your specific financial situation and your specific circumstances.
Great. The next question is from one of your very first slides. Can you please repeat the cost estimates you mentioned about annual nursing home and help at home care?
Sure. Let me stop sharing my screen and pull that back up because I don't have them memorized either. Yeah, so this is according to Genworth Financial, who provides, is the largest provider of long-term care insurance, or one of the largest providers of private long-term care insurance. But they report that in Tennessee, the cost of a semi-private room is $84,863 a year. And then for a home health aide, to work 40 hours a week in the home. In Tennessee, the median price tag is $43,680 a year for that care. So, not cheap.
That's a lot.
That's why we're seeing more and more really substantially middle class families having to turn to Medicaid because they can't afford it. I mean, it's really, really expensive. So that's where we are.
Turn my video on so I'm not just a talking voice. So the next question is, if a patient is dual eligible for Medicare and Medicaid, will Medicaid pay for any long-term care?
Yes, Medicaid is always going to be like a secondary payer. And so Medicaid won't, the Medicare 100 days are still, you'll still have access to those benefits, but the choices services won't start until you put in until those Medicare days are used up. And you put, the nursing home has to input what they call a Medicaid only payer date. And then your Medicaid would then step in and start paying after those 100 days, as long as you qualify for choices medically and financially.
Great. So the next question is, what are considered assets?
Yeah, so that's a great question. Your assets are, so we know that one home and one car is excluded. So if you have extra property or extra houses or something like that, so any extra real estate besides your homestead, that would count as an asset. Additional cars besides the one will count as an asset. Money that you have in a bank account, money that you have on hand, cash counts as assets. They look at your 401ks, and they'll look at when a common asset we see causing problems is life insurance policies. So the cash value of life insurance policies does count towards that $2,000 asset limit. So some people, before they're able to qualify financially, they have to irrevocably place their life insurance policies. So that means assigning their life insurance policy payout to a funeral home. So that way there's no sort of cash payout value. But some people's life insurance policies don't have a cash value, or the cash value is below that $2,000 limit. So, so that's something to keep in mind. Resources, assets that are considered unaccessible don't count towards that $2,000 limit. So that could be property or homes that have been on the market for a long time and just aren't selling. Those, you can sort of ask the state to make sure that those don't count against that $2,000 limit. But yeah, there's a whole list of assets that are counted and not counted. And we can send out a resource that sort of breaks down a few more and describes a few more of those asset limits. When we send out the slides tomorrow, I'd be happy to include that.
Awesome. So the next question is, where can we find the information on what the QIT trust funds can be spent on besides the TN care liability to a facility and the $50 personal needs allowance?
Yeah, so I recently learned a little trick about the money going into the QIT from Pam Wright, who is one of I think the first officially certified elder law attorneys in Tennessee. She explained that money that goes into the QIT, she encourages families to put the money into the QIT that needs to go into the QIT, and then to pay themselves immediately with a check. And as long as you write personal, what is it? Personal, what's that word? Personal payment, I forget the word, but the amount that you're allowed to keep. So if you write yourself a check for your personal needs allowance, there it is. If you write yourself a check for your personal needs allowance, as long as it's not above that $2,000 limit, you can just pay yourself that back out immediately, and TennCare won't sort of flag it as an issue. But you can pay for insurance premiums with out of the QIT. You can pay for incontinence supplies if you need those. Any sort of medical need or medical purchase that is not covered by TennCare. So glasses, dentures, things like that can also be paid out of the QIT. A lot of times it's not a big deal for people who are put into, who are in a nursing home, because most of their income goes to the nursing home for patient liability as part of their patient liability anyway. So the money that goes into the QIT goes right back out and goes to the nursing home. So for nursing home applicants, the QIT, the money that accrues in the QIT, I mean, is a non-issue because it's all going to the nursing home. But for some people who are required to get a QIT who are in Choices Group 2, they might have to do a little bit of finagling to figure out how to spend that money that's going into the QIT.
Perfect. So we have 2 more questions. Is the 5-year look back period starting with the application or after the person has been in the program for 5 years?
No, so that's at the application. At the point of application, TennCare will look back 5 years, from the point of application to see if any assets were given away or sold for less than fair market value. There are exemptions to the penalty, or there are ways to sort of remedy the 5-year look back period. Like you can ask for the asset back if you gave your house away to your child and then you realize that there's this 5-year look back period, you can ask for the asset back. You can also apply for a hardship waiver if you can show the state that you gave this asset away or you sold this asset for some other reason besides just becoming Medicaid eligible. Then sometimes the state will excuse that sort of improper transfer. But the look back period starts from the day you apply and then looks back to see what sort of resources. And that's just to keep, like I said, it's just to keep families from spending or giving away their assets to their children just for the sole purposes of becoming Medicaid eligible. So the state wants to make sure that if a person is financially situated to at least pay for some long-term care, that they do pay privately for some long-term care before they have to turn to a social safety net program like Medicaid. But any confusion or issues with that, or if you get told that you have a penalty period or that there is some sort of improper transfer in your 5-year look-back period, then you can contact TJC and we can see if we can help you sort of manage that issue. When I used to work at an area agency on aging and disability, and when I was helping people apply for choices, I would look over their bank statements and I would circle things that were over $400 and say the state's gonna, any income or things that were spent, over $400, I would say this TennCare is gonna wanna know what this is. That's not like a rule that's in a manual anywhere or in the law. That's just a sort of rule of thumb that any sort of, TennCare is not going to go back over 5 years and scrutinize every single $20 bills you gave away or whatever. They're going to look for bigger expenses. And they're pretty good at being able to find things in the past. So sometimes people, want to try and hide like a life insurance policy that they have, or try and sort of not hide, but just, I don't know, not be forthcoming with these assets or with certain assets or certain transfers of assets that may have happened in the past. But TennCare has the ways of finding those things. So it's better to sort of just be upfront about them at the beginning and come up with a mitigation strategy versus trying to hide it away or squirrel it away.
Awesome. So last question is, how do you apply for the QIT?
Yeah, so a bank will help, you can either individually set up the QIT yourself by like printing off a QIT document online. You can also, lots of banks will require that you go to a lawyer to set up the QIT, and they'll draft the QIT document. And then you just take the QIT document to your bank and they'll notarize and get the special bank account set up. But it's not really something that you apply for. It's just, you have to set it up. So you get somebody, either you draft the QIT by looking at a template online, or you talk to a lawyer who can help you draft the QIT paperwork, and then you take that paperwork to the bank for the bank to set it up.
Great, those are all of our questions.
Well, great. Thank you again, everybody, for joining. I know that we went a little bit over, and thanks to everybody who stuck around, and be on the lookout for more training opportunities, and have a great rest of your day. Thanks.